Hi, I'm Dr. Christopher Zoumalan, a board-certified oculoplastic surgeon and also the creator of the natural-looking blepharoplasty technique. Hi everybody, I wanted to introduce you all to Nurse Eva, who's our latest addition to our team. Nurse Eva has an extensive training in both aesthetic medicine, also in the OR as an ICU nurse. She's also getting her nurse practitioner degree, which is amazing. So she's all about research, she's all about learning the latest and most clinically effective treatments for our patients. I have been looking for somebody to help me in my practice as I continue to grow with my expertise in surgery, to provide the level of expertise that my non-surgical patients desire, such as Botox or injectable fillers or laser treatments, for instance, when it comes to periorbital vein removal. These are things that I've wanted to incorporate in my practice for a very long time. So it's been a great addition to having Nurse Eva here, and her clinical interests will be an amazing asset in addition to our practice. So when you're coming into our office, you're going to be greeted by Eva in the future when it comes to Botox injections or it comes to filler injections around the face, or also laser treatments that we're now offering in our practice, which we're really excited to offer and super thrilled of having her here. So one of the challenges of achieving eyelid rejuvenation is when it comes to visible veins around the eyes and the eyelids. Those are not easily treated by surgery. Sometimes they can be improved at the same time as a blepharoplasty, but oftentimes they're not. Periorbital veins are very common. Most of us have them, and a lot of times they're not really visible, but to some patients they are visible. They look like very faint bluish veins along the lower eyelid. Depending on their location, depending on their size, they can often be reduced or completely essentially eradicated with the use of a YAG laser. A YAG is a type of laser, it's a certain wavelength of a laser that penetrates these blood vessels, and it helps to shrink the blood vessels. Oftentimes it can be done with one treatment, but it may often require multiple treatments spaced apart. Now we have a very specialized laser here in the office that provides that sort of treatment for these particular type of veins around the eye area. This laser can also be used to treat veins around other parts of the body, and Nurse Eva will evaluate you to determine whether you are a candidate for the YAG laser for these particular types of vein issues that are bothering you. So we're really excited of offering this addition to our practice. It's something that I've been waiting for, looking for, adding, and now's the time. So if you have, for instance, a vein around your eye that you're concerned about that is bothering you, reach out to our office. Our office staff will, request some photos that we can evaluate and see if that type of vein could be improved with our YAG laser.
What I love about the YAG laser, it could target fine veins on the face, and it could also deal with more difficult spider veins on the legs. It is a fairly non-invasive procedure. There is minimal pain. Patients usually describe it as a zap sensation on the skin. What the YAG laser will do, it will occlude the spider vein or the vein that is visible on the surface of your skin. It will occlude it and it will stop the blood flow to that area. Therefore, the discolorations will go away as well. We will start the treatment by making sure the area is clean. We will apply ultrasound gel to prevent any skin burning. We will also apply an eye shield to prevent any interaction with the eyeball, so your eyes are protected during this procedure. Our procedure usually takes from 15 to 20 minutes, depending the area that we're treating. If we're treating the face, probably we'll need less time versus treating the legs because there is more area there. Patients can benefit from 1 session to 3 sessions depending on results. Reassessment is in 6 weeks. In 6 weeks, you would come back and we reassess the area. If you need an extra impulse there, we can take care of that. There is minimal to no downtime. You can go back to your daily activities right away. You should avoid the sun after the procedure. If you do need to go under the sun, make sure you use SPF 45 or higher. Make sure you hydrate after the procedure and enjoy your results.